Miss Ryan, I heard that you have been doing well. So let me just listen to your heart and to your lungs. Is that okay with you?
Yes. Hold on.
Okay. Take a deep breath. Out. One more time. Well, looks like you're ready to go home. So I would like to see you in my office in 1 week. Okay?
Wow.
So have a good day.
Thank you. Hey, come get me. I'm discharged.
Sharon, could you please tell Mary that Miss Ryan is ready to go and she needs to have her Coumadin before she leaves? Thank you.
Hi, Mom. Ready to go? Jennifer's going to be so happy you're going to make it to her graduation. What about all these tubes hanging off my mom? Can somebody come and help her? The cardiologist came in and told us she can go home.
What room is she in? I'll have to call her nurse.
Room 202.
This is Mary.
Yeah, room 202. Mm-hmm.
I don't see a discharge order. Have you seen Dr. Jones, the hospitalist?
Bonnie, is she in the shot?
Could you please put a call out to Dr. Jones to come see Mrs. Ryan? Her son's here, and the cardiologist said she could go home.
Oh, this is Dr. Jones. No, there's no way I can be up there for at least 2 hours. I'm in the emergency department admitting 3 patients. Why did Garcia tell the patient she could be discharged right now? He knows how it works around here. No, I'll get up there when I can. All right, bye.
Hi, Mrs. Ryan. My name's Barbara. I'm one of the pharmacists, and I'm here to talk to you about your Coumadin today before you go home.
Has she had her Coumadin today? And we're going directly to my daughter's graduation from here. She needs to have all her medicine before we go. We need to be able to leave probably in the next hour. Can we get this? Will this be possible? Can you tell me? I have no time to get her prescriptions. How am I supposed to get her pills? This is a really important medicine, right?
Mrs. Ryan, Dr. Garcia has cleared you for discharge, but Dr. Jones needs to see you and write the discharge order. And then we need to update your Coumadin orders and do your medication list. And respiratory therapy needs to assess your need for oxygen at home, and dietary needs to come and go over your diet for home. So this is all going to take several hours.
We have got to speed this up. I mean, this is ridiculous. Do you guys not even... We don't have time for this. Don't you guys even speak to one another?
I'm sorry, sir. It's a process that
This
needs
is
to
so
happen.
unorganized. I can't
Several
believe this.
departments need to come and see your
We don't
mother
have
before
time.
she
She
can
needs
go.
to leave now. We do not have hours.
But she's not prepared right now to go home. We have to. I'm so sorry, but we'll try to speed it up as much as I can. Looks like Mrs. Ryan's getting discharged today. She may need some oxygen at home.
First of all, there's no desaturation test done on this patient. She has to meet criteria before any home oxygen can be ordered or delivered. Let me check her insurance to see who the local provider is and who can deliver the oxygen.
be up there right now. Patient's here to wait. Good morning, Mrs. Ryan. Is this your son?
Yes, this is my son David.
Hi, David. Nice to meet you. I'm Dr. Jones. I'm the attending physician, and this is the interprofessional team. We're here today to talk about your plan of care for the day. So I'll let the team introduce themselves.
Well, you already know me. David, I'm your mom's nurse for today. I'm Mary.
And David, we've met before. I'm Dr. Ty, one of the second-year residents that's a part of your mom's healthcare team.
I'm Joanne, the case manager. I helped develop the plan for when your mom goes home.
And I'm Barbara, her pharmacist.
We expect to be here a little less than 10 minutes. Dr. Ty, the resident, will come by later this afternoon to check on you and answer any questions you have. I know there's a lot of people in the room, but a team approach ensures that you get the best care.
During rounds, we'll be discussing your care, what's happened in the last 24 hours, and we'll together be formulating a plan for today. Now, we may be using a lot of medical terms, so be sure to ask questions if you have any. You and your family are an important part of the team, so we'll provide some time for you to ask questions. Thank you for allowing us to be here today.
So Miss Ryan's a 7-year-old female with a past medical history of chronic atrial fibrillation, a non-ischemic cardiomyopathy with an ejection fraction of 25%, with a biventricular ICD and pacemaker. She was admitted yesterday for volume overload. She was given 40 milligrams of IV Lasix, responded well. She's down 2 kilograms. Her BNP is 850. However, she still continues to have shortness of breath with activity. Her O2 saturation on room air is 87%. However, her chest x-ray has improved since admission.
Here's the situation. Mrs. Ryan had a comfortable night on 2 liters of oxygen. She said it was the first restful night she's had in over a week. The background is that this is her second admission for heart failure in the last 6 months. Assessment, she's still got some bibasilar crackles. She's got oxygen saturation of 93% on 2 liters, and she has voided 3,800 milliliters in the last 24 hours. Recommendation, I'd like to get dietary up here to talk to her about fluid restriction and low sodium diet, and I have reinforced with her the need to weigh herself every day at home.
Okay. Mrs. Ryan, I'm going to listen to your heart and lungs now. All right, Mrs. Ryan, your lungs sound improved, but there are still some crackles at the bases. So let's talk about the plan. Are we all in agreement that with a little more fluid removal, Mrs. Ryan can probably be discharged tomorrow morning?
Yes, I'd like to go over her medications with her before she goes home. Adhering to her scheduled medications is going to be important to keep her out of the hospital. Currently, she's on lisinopril 2.5 milligrams daily, spironolactone 12.5 milligrams daily, metoprolol 25 milligrams daily, Coumadin 2 milligrams daily, and Lasix 40 milligrams daily.
When I spoke with Mrs. Ryan about what was most important to her today, she told me that her granddaughter's graduating tomorrow and she'd really like to be there. She's feeling so much better. That would mean we'd all have to get her out of here pretty early tomorrow morning.
If that's the case, then I suggest that we give David the prescriptions ahead of time so that he can get the medications filled and everything can run smoothly.
And let's go ahead and get an order for a DSAT test so I can arrange with a local provider to get the oxygen at home if she's needing it.
So I'll contact Dr. Garcia to let him know that we've met the goals for discharge and that we're working together as an efficient team to get you discharged early tomorrow morning. Would you guys like to summarize what our plan is? So Mary, you wanted to get a nutrition consult?
Already on it. I'll call him as soon as we're done here.
Great. And Joanne, can we arrange home oxygen?
Yes, I'll verify the benefits so that the home oxygen can be delivered to the hospital room so she'll make it in time for graduation.
Okay, great. I'll go ahead and write the prescriptions so David can get them filled. Barbara, I'll work on the med reconciliation so that you can go over the medication instructions. Mary, I'd like to give her 20 milligrams of IV Lasix. Do you have any questions or concerns?
I just really want to go home tomorrow morning as early as possible.
Okay, we'll do our best to work as a team to make sure that you make it to your granddaughter's graduation.
Good morning, Miss Ryan. How are you this morning?
Morning.
I would like to listen to your heart and to your lungs one more time, okay?
Okay.
Deep breath. Good. Deep breath. Very good. Well, from the cardiologist's perspective, everything seems to be fine. So now, I would like to see you in my office in 1 week, and Dr. Jones and his team will stop by in a few minutes to be able to start the discharge process. Do you have any questions for me?
I received some dietary education, and the pharmacist and the nurse has spent time with me regarding medications. I know that I have to weigh myself every day. My goal is to stay out of the hospital. Thank you very much.
Well, I'm glad that you're doing better, and hopefully everything will be fine, and I'll see you in my office, okay?
Thank you.
Have a good day.
Bye-bye.
All right, Mrs. Ryan, your lungs sound good. Dr. Garcia has cleared you also, and Mary tells me that she's discussed with you the importance of restricting sodium in your diet, checking your weights daily, and also making sure you take your medications as prescribed. And I understand that you have an important date with your granddaughter today.
Yes, I do.